All right, once again, I want to thank everyone for joining us today. For those of you that don't know me, I'm Lindsey McKay, owner and lead advisor at McKay Wealth Management, and we do educational seminars throughout the year. And today's topic is Get to Know Medicare. So I'm excited to have brought in a Medicare specialist that can help us not only understand kind of some of the specifics about when we need to start Medicare, but what does Medicare cover? What are the things that we just really need to know when we think about it as a broad topic? But before I introduce our speaker, I do want to just remind of a couple of housekeeping items that I already touched on. I think the biggest thing is it's a complex topic. We're probably going to take the full hour, but we want to encourage questions as we go. So there is a question and answer box in the bottom middle of the screen. So if you have questions, please put them there. We won't be unmuting people or being able to answer questions live. So please use the Q&A box. And with that, I'm going to introduce Cindy Hagen. I'm actually just going to let you do your full introduction because you were sharing with me all of the different providers that you can work with and all the different resources that you have. And so while United Healthcare is the name on the presentation today, it's a whole universe of Medicare out there. And Cindy's going to help us learn how to navigate it. And it's also available as a resource if you want to need to enroll, need to make changes during open enrollment. So Cindy, I'm going to let you be the expert and carry the conversation from here.
Sounds good. Thanks, Lindsay. Hi, everyone. My name is Cindy Hagen. I am a life and health insurance agent, and Medicare is one of the main areas that I work with. I've been doing this for about 18 years, and I'm located up in North Seattle. As Lindsay mentioned, United Healthcare is on the slide deck. I simply chose their slide deck because I felt like it was the clearest. But I also work with Regions and Premera and United Health or United Healthcare, Humana, Aetna, and Kaiser Permanente. So this is not to say that we're limited to United Healthcare. Their educational slide deck was just the most helpful. So we're going to start here. So again, I know this is some disclaimers that Lindsay needs to have up on the slide deck. Again, I don't work with every single Medicare Advantage company out there. Everything is available on 1-800-Medicare, Medicare.gov, and on the state website. So if you're looking for information about a particular carrier, those are some places that you can check that out. But let's get into it because right now we're going to just talk about Medicare and figuring out what it is. Now, a lot of people have had insurance through an employer or through a spouse or maybe on the Washington Health Plan binder. So when you start to hit your 60s and looking towards Medicare, Medicare can be a little overwhelming. And you are not alone. If you're feeling like this is a lot, you're not the only one. So we're going to talk a lot about just kind of some basics, how Medicare works, what options are available to you, and go from there. So hopefully I'll be able to answer your questions before you even know it has occurred. Okay. So, Medicare's insurance. It's a federal insurance program for U.S. citizens and legal residents. It's funded by the taxes that you pay while working, as well as the premiums that you're going to pay while you're on Medicare. It's individual health insurance. So, if you've had coverage with a spouse or your kids have been on your plan, know that when you have Medicare, it is individuals only. So, you and your spouse would each have to have your own Medicare plan. Medicare is not free. It's not a family plan. It's not Social Security, and it's not Medicaid. So keep that in mind. So just a side note on Medicaid. Medicaid is for those who are low income, and every state handles those things a little bit differently. And it is possible to have Medicaid and Medicare at the same time, but I'm guessing that most of the folks who are on this call at this point are probably not going to be eligible for Medicaid. Okay. When and who can get Medicare? You get Medicare, you're a US citizen, you're a legal resident. You have to be 65 or older in most cases. If you are under 65 and you have a qualifying disability, which could be end-stage renal disease or ALS, if you've had Social Security disability for 24 months, that could be another reason to have it. But most folks are going to be enrolling the month that they turn 65. Did it go backwards? Okay. Do you need Medicare if you plan to work 65? Now, this is something that can be a little complicated for people. And so if anyone ever has questions about their own situation, you're welcome to contact me and we can kind of work through it together. In general, most folks are going to want to enroll in Medicare when they turn 65. However, if you work for an employer who has 20 or more employees, then you may want to stay on your employer plan. The coverage for Medicare would be secondary to any coverage with your employer, and coverage with Medicare might be more expensive than it would be to stay on your employer insurance plan. So you'd want to take a look at your benefits, your costs, and see if that makes sense. If you're working for a small business, or if you are self-employed, or if you have coverage just on the Washington Health Plan binder, then those are situations where in general it's best to enroll in Medicare right away at age 65. Now, at the bottom there, what if I'm covered by my spouse's employer? This is where it gets a little complicated, right? Because if you are turning 65 and you are the employee who has coverage, if you enroll in Medicare, your spouse may no longer be eligible to be on your employer plan, right? Or if you are the younger spouse who has the employer coverage and the older spouse turns 65, you may not want them to stay on the employer coverage because it could be more expensive than going directly to Medicare. So this is a situation where it's important to understand how your coverage works, what your options are, and talk to, the HR department or someone like me to help you figure out what makes the most sense for being on Medicare. Lindsay, do we have any questions at this point?
Nope, looks like we haven't had any come up yet, so we can keep
Okay, because I know this gets complicated, so please don't hesitate to ask if you have questions about this. Okay, so again, Medicare, you can have Medicare and your employer coverage together at the same time. Often I find that it doesn't make sense. There's no reason to spend extra money on it when Medicare is going to be secondary to your employer coverage. It's also important to note that if you do enroll in Medicare, you're no longer eligible to contribute to a health savings account if that's the type of coverage you have through your employer. And again, that final reminder, Medicare covers just you. So if you have kids or spouses who are on your employer coverage, you'll have to figure out how they're going to get coverage once you leave the employer coverage. Okay, so now we're going to get into Medicare itself. So Medicare has two parts. It has Medicare Part A and Medicare Part B. In general, Part A is hospital insurance. So this is when you're in the hospital. So it's paying for, you to be in the hospital, it's paying for the nurses, it's paying for all the things that are going on in the hospital. Part B is medical insurance, which includes doctors and surgeons while you're in the hospital, as well as outpatient care. So most people find that they're using their Part B of Medicare on a more regular basis, right? For your physical therapy, for seeing the doctor, for going to the dermatologist, all those kinds of things. Part B is probably the part that you're going to use on a more regular basis. But here's a little bit about what Part A covers. Your hospital room, care and intensive care, prescription drugs while you're in the hospital, not the prescription drugs you take at home, but the ones that are administered in the hospital, labs, x-rays, sometimes blood transfusions, hospice care, all those kinds of things. So Hospital Part A does not have a premium associated with it. It's basically free to you, assuming that you or your spouse have worked for 10 years or longer. It's nationwide. It's covered by benefit period, or I like to call it per event. What this means is Part A looks at your hospitalization per event. So if you have surgery in January, you're going to have charges for Part A based on that surgery in January. And then say you have another surgery in June, or maybe an ER visit that resulted in a hospital stay or something along those lines. That would be a second event and would be billed and charged separately. Part A has a deductible for each event, and currently that deductible is $1,676 per event. All right, Part B. Part B is separate from Part A. Remember, this is again covering doctor's visits, your wellness visit, labs, x-rays, things that are outpatient services. All right. And here is a quick chart of some examples of that. Part B does have a monthly premium. Remember, Part A does not have a monthly premium, but Part B does have a monthly premium. It is based on your income, and we want to keep it complicated. So it is based on your income from 2 years prior. So right now, if you joined Medicare in 2025, your monthly premium for Part B would be based on your 2023 income, right? The base premium right now for Part B is $185. So everybody is going to pay at least $185 per month for Part B, and it can go up depending on what your income was 2 years prior. If you don't sign up for Part B when you are initially eligible, then you could face late enrollment penalties or may have to wait to enroll till the beginning of a calendar year. Now, if you've been on employer coverage up till this point and it's creditable coverage, then you would qualify for a special enrollment period and the late enrollment penalties would not apply.
Cindy, we did have a quick question about the income. And so the question was, do they look at just your income or you and your spouse's? And
They, yeah, they look at household income. So you each have an individual premium, but the household income for a spouse or a household of two is basically going to be double, right? So it's the same uh, result as if you were single, if that makes sense. Does that answer the question, I hope?
it does. Yes, thank
Okay.
you.
Yeah, and if you want to look at what the charts are for the income, if you go to medicare.gov, you can just in the search bar, just search on Part B premium, and it'll bring up a page that will talk about the premium, and it will have a little pop-up chart that will indicate what all the premiums are so that you will see, hey, for someone who's single, here are the income limits for the base premium. Here is the income limits for a household of two. Okay. There's a number of things that Medicare doesn't cover, right? And so we have to be very aware of that when we're thinking about what we want to do for our coverage. Um, Medicare does not cover drugs, dental, vision, or hearing. And those are kind of the big four that I think about. It also doesn't cover long-term care, excess charges, care outside of the US, except for in certain circumstances. But for most people, it's going to be the drugs, the vision, the dental, and the hearing that most people are concerned about. And so there are ways to get coverage for those things that we're going to talk about in a little bit. Okay, so if you take anything away from this time, it's please address your drug coverage. right? Drug coverage is not covered by original Medicare, and you can get coverage either through a standalone drug plan or through a Medicare Advantage plan that has drug coverage built in. The reason I want you to consider getting some sort of drug plan, regardless of your situation, is that if you choose to defer getting drug coverage and you enroll in a drug coverage plan at a later date, there is a late enrollment penalty that is added to your monthly premium, and it's permanent and it doesn't go away. So even if you have no medications, I highly recommend picking up either an inexpensive Medicare Part D plan or look at the Medicare Advantage plans, and it will just protect you um, in the long run, right? Because if 20 years from now you have cancer or another chronic condition and you need drug coverage, you may find that it costs more for the drug coverage than the drugs themselves. So I think it's really important to protect yourself and have a drug plan of some sort. Okay. So now we're going to get into Medicare Advantage plans, and we're going to talk about what they are, how they work, and what your options are with them. So, what happens with a Medicare Advantage plan? It's an alternative to original Medicare. And what happens is the insurance carriers will contract with original Medicare and they will say to original Medicare, hey, Joe is purchasing a Medicare Advantage plan. We are going to provide Joe his Medicare medical services and his benefits and his claims in lieu of original Medicare doing it, right? So they're going to provide the Medicare services for this individual rather than going through original Medicare. You still have to stay on Medicare, you still have to pay for Part B premiums, still have to have Medicare Part A, but the benefits are administered by the plan, and most of them are going to have built-in drug coverage and other additional benefits. Because basically, what is happening is the Medicare Advantage plan says, hey, we will provide services at a level equal or better than what original Medicare offers, right? So they're going to have all the benefits of Part A, they're going to have all the benefits of Part B, then they're going to add prescription drugs, most of them, and then they may add dental, they may add vision, they may add hearing, they may have a fitness program, other memberships, or other benefits that original Medicare doesn't offer. One nice thing is that these are all in one, right? So they're going to be very similar to the plan you might get from the health plan finder or a plan you might get from your employer. You know, they're going to have copays, they're going to have co-insurance. And so people are going to feel pretty comfortable with these plans because they're very similar to what you've got going. Um, There's a number of different types of Medicare Advantage plans. I'm not going to get into this in too much detail. A lot of these have to do with the kinds of networks of providers that they have. And you have to keep in mind with Medicare Advantage plans, they do have networks of doctors that you would use. In general, if you're on a health maintenance organization plan, that means you have to go to an in-network doctor or there will be no coverage, right? So you have to stay in the network. If you're in a preferred provider oops, sorry, I went back. If you're in a preferred provider network, they're going to cover their in-network providers at a lower level than providers who are outside of the network, but you still have the freedom to see providers who are outside of that plan. So those are going to be the two most common options you're going to see in Washington State. Okay, so here are some fast facts. Again, as I mentioned, you have to keep Medicare Part A and Part B. You do have to live in the service area. What that means is Medicare Advantage plans are sold by the county that you live in. So Depending on whether you live in King or Snohomish or Pierce County or Thurston County, your options may be different based on the carriers who are selling Medicare Advantage in your area. You can't be denied coverage based on financial or health status, as long as you're applying during an open enrollment period or your initial enrollment period when you turn 65, they have to take you. You may be required to use provider and pharmacy networks. And this one, the coverage and costs vary by plan and may change each year. And I think this one is really important to keep in mind because Medicare Advantage plans have to cover everything that Medicare covers, but that's the only limitation, right? So if they add any benefits, whether it's dental or vision or hearing, those are extra. So there's no requirements on what they have to offer. So to some extent, you kind of have to hold that stuff lightly because it could change any year as they change what their plans are. The nice thing about these Medicare Advantage plans is that they do have an annual limit on out-of-pocket services. And so that protects you. If you're on original Medicare, there's no cap on the costs that you could spend. So, it's those deductibles for your hospital visits. It's the 80-20 split for Medicare Part B services. There's no cap to that. Whereas a Medicare Advantage plan will have a cap on your annual out-of-pocket costs. Now, these Medicare Advantage plans can charge a monthly plan premium, and that is in addition to your Part B premium. So with Part B, maybe you're paying $185 a month for that. Your Medicare Advantage plan could have a premium. Now, most premiums for Medicare Advantage plans are anywhere from $0 to probably $50 a month. There are some that are more expensive. And so you would have to continue paying those monthly plan premiums. Now, when you have a $0 Medicare Advantage plan, it's important to remember that it's not free and it's not that the plan doesn't cost anything. When the Medicare Advantage plan contracts with Original Medicare to provide you with your services, the government is paying them a stipend every month, basically, to provide you with your medical services instead of Original Medicare doing that. So if a Medicare Advantage plan costs $0, that's just telling you that they're able to provide you your services for the amount that they're getting from Medicare, right? And if there's a charge for that plan, it just means that those extra benefits that they are providing you, there's a required premium to be able to provide those benefits to them. Okay, so that's the end of Medicare Advantage. Are there any questions, Lindsay, about the Medicare Advantage plans?
It looks like one of the questions that's out there is actually back to a comment you made earlier about the drug coverage, which I know we're just getting into, and you said that's the one takeaway from today, if nothing else. The question was if
Uh-huh.
you're still working and therefore delaying enrolling in a Medicare plan, do you also delay the drug plan as well?
Yes, because and what you'll want to double check is with your employer, make sure that your coverage is credible. And what credible means is that the drug coverage on your employer plan is equivalent or as good as coverage with Medicare. So if your coverage with your employer is as good as the coverage with Medicare, then there is no reason to get Medicare, assuming you're with an employer of more than 20 people. If there's less than 20 people, you'll probably want to get a drug plan and sign up for Medicare. But again, happy to talk to people offline and directly about those situations.
Great, thanks for answering.
Okay, so prescription drug coverage. As Lindsay said, my one plea is that make sure you address your prescription drug coverage. There's two main ways to get it. One is a standalone Part D plan. So that is a plan that covers only drugs, doesn't cover anything else. The second option And a completely separate option is the Medicare Advantage plan that includes drug coverage that we just talked about. It's important to know that you cannot do both of these things at the same time. You can't have a Medicare Advantage plan with drug coverage and a separate drug plan. You can't double dip on drugs. So it's going to be one or the other. Okay, so drug plans cover drugs most commonly prescribed for Medicare beneficiaries as determined by federal standards. Specific brand name drugs and generic drugs are included in the drug list or the formulary. It's important to note that the formulary is not a standard formulary. Each plan has its own list of covered drugs. Every plan is required to cover a wide range of both generic and brand name drugs that are generally needed by folks. But it's important to note that one plan may be better for your situation than another based on your prescriptions. So you don't want to just assume that any old drug plan will be fine. You want to make sure you look up your drugs and figure out which plan has the best coverage for your specific needs. So, just like they are on your current plan, there is a formulary and there's different tiers of drugs. They're grouped based on cost and the types of drugs. For instance, tier one are the least expensive medications. They are generally preferred generic drugs. I like to call tier one drugs your maintenance drugs. So these are going to be your blood pressure medications, your cholesterol medications, the things that, half the world is taking and is taking on a daily basis and is probably going to be on for the rest of their lives. There's those just maintenance medications. And then from there on, we have, often these are going to be non-preferred generics or preferred brand names or non-preferred brands or specialty drugs. And as the tier get higher, the drugs get more expensive. Now, prescription drugs can also have a deductible affiliated with the coverage. Doesn't apply to all levels. Generally, tiers one and two probably will not have a deductible. You'll just pay a copay. And then tiers 3 through 5 may have a deductible that is associated with them. So here's kind of what it looks like for drug coverage. Now, this applies whether it's on a Medicare Advantage plan with drug coverage or if it's on just a standalone drug plan. And there's 3 different cost stages, and the stage you're in determines the amount you pay when you fill a prescription. So we have the annual deductible. So if you have a drug where the deductible applies, you would be responsible for whatever that deductible is before the insurance company kicks in. Then once you've paid that deductible, you'll either have a copay or co-insurance, and then your insurance plan will pay the rest. So this could be as low as, $0 or $5 a month. It could be $47 a month, or it could be a percentage of the cost of your drug. And then you'll see down here, there's a sorry about that. There is a combined total of $2,000. This is new. And I think this is a really, most people aren't going to hit this with their medications, but for the people who do, if this is a real important benefit. There is a $2,000 cap on prescription drug coverage. Once you pay $2,000, all of your costs after that for covered medications are covered. If you have friends who are older and you've heard about the donut hole and things like that, that is all gone now with Medicare. So now we have this cap of $2,000 and that goes through the end of the calendar year. Have to remember, benefits are always January to December, and then everything restarts on January 1. Okay, so to have prescription drug coverage, you have to have Medicare Part A or Medicare Part B or both. There are pharmacy networks that are affiliated with the drug plans. So similar to a network of doctors, there's going to be a network of pharmacies. Sometimes that can make a huge difference. Sometimes going across the street to the other pharmacy may save you $200 a month. So it's important when you're looking at the drug plans in Medicare.gov that you plug in your favorite pharmacies or plug in a couple different pharmacies that are near your home that you would be willing to go to. That can make a huge difference. Coverage and costs vary by plan and may change each year. So not only do I want you to make sure you have a drug plan, but I want you to review your drug plan every year because you may find that, oh, I have a new drug or I'm no longer needing to take a drug, and that can significantly change the plan that would be the best fit for you. Similar to Medicare Part B, if you enroll in Part D late, if you choose not to have drug coverage for a period of time, there is a potential for a late enrollment penalty. I was talking to a woman, her late enrollment penalty was going to be $75 a month, right? So we want to avoid that when at all possible. In 2025, there are a couple of different drug plans in Washington state that are currently $0 a month. So there are some pretty inexpensive options if you need to have a drug coverage just to protect yourself. Okay, are there any questions, Lindsay, on the drug coverage or anything else?
No additional questions have come in.
Excellent. Okay, so now we're going to talk about supplement plans. Supplement plans are an alternative to Medicare Advantage plans. Now, in talking about the Medicare Advantage plans, we were talking about how they contract with the government and there's a stipend, and you may only pay $0 a month for your Medicare Advantage plans. I describe the Medicare Advantage plans as back-ending the risk. The plans are pretty inexpensive, but if you had an event or a health condition come up, you're going to be paying more on the back end. You're going to be paying co-pays and things like that for your care. I describe the Medicare supplement plans as front-ending the risk. They're going to be more expensive than the Medicare Advantage plans. But in trading off a higher monthly premium, you know that on the back end, if something were to happen, if you needed surgery, if you needed a heart transplant, if you needed, a knee replacement, your costs are going to be much lower on the back end because you have been paying a larger premium on the front end. Okay, so they work completely differently. What's happening with Medicare supplement plans is they leave original Medicare in place. Original Medicare is still in play. So when you go to the hospital, when you go to the doctor, original Medicare is handling your claims, handling your benefits. What the supplement plan does is it comes in and it pays the out-of-pocket costs that would have been your responsibility for Medicare. So Part A has a large hospital deductible. The Medigap plans would come in and they would pay that deductible. You have to pay 20% of outpatient services. That Medigap plan, it's going to come out and it's going to pay the 20% that would have been your responsibility. Now, there's a few different structures and plans for these Medicare supplement plans. And here's a chart. These are all the options. And I will say this one, Plan G, right here in the center, versions of the Plan G are probably the most popular because they're the most robust. They basically pay everything that they're allowed to pay. You're going to notice that the Part B annual deductible, none of the plans are allowed to pay for that, right? So you know that you're still going to have to pay your Part B deductible, which is currently $257, right? But after that, you can see Plan G pays 100% of everything else that would have been your responsibility. The one exception is the foreign travel. right? It pays 80%. Well, original Medicare doesn't pay for foreign travel for the most part. So the fact that Plan G will pay 80% of the foreign travel emergency is a nice little perk. You have to be careful though, because the plan limits are $50,000 lifetime, right? So it's not a lot of foreign travel, but based on where we live in Washington, if you're going up to Vancouver for the weekend, or you want to go down to Mexico for a week or whatever, you may find that knowing you have $50,000 is enough. But just keep in mind if you're going to bicycle across Italy or climb the Alps, you may want to get a more robust policy just for that. Okay, with the supplement plans, you must be enrolled in Medicare Part A and Part B, live in the state where the plan is offered. There's no medical underwriting up to 6 months after enrolling in Part B at age 65 or older. So when you first become eligible for Medicare, that supplement plan, they have to take your application. There is no provider network. And so people really like that, especially if you're retiring and you're like, hey, I want to rent an RV and I'm going to go visit all the national parks in the US. Well, this plan has national coverage. There's no provider network. You just have to go to a provider who accepts original Medicare. And so that can be really nice. Okay. We've talked a little bit, I know, about how much Medicare costs. So you have your monthly premium, whether that's for your Medicare Advantage plan or your Medicare Supplement plan. There's deductibles that can apply, copays, and coinsurance. So if you're on a Medicare Advantage plan, as I mentioned, there's low or no monthly premium. You may have a deductible that applies, and you'll have copays and coinsurance and an out-of-pocket maximum that will cap how much you will pay for a year of services. Generally, that out-of-pocket maximum, at least this year, is anywhere from, $6,000 to $8,000, depending on the plan that you select. So while you have a $0 premium, you might be on the hook for six, seven, $8,000. The Part D prescription drug plans do have a monthly premium. Those premiums vary widely, anywhere from 0 to $83 a month. And then the copay, the deductible, and the coinsurance. And as I mentioned, the out-of-pocket maximum is $2,000 for your drug plans. One thing to keep in mind is while Medicare Advantage plans do have drug coverage, the drug coverage has its own out-of-pocket maximum, right? So the Advantage plan may cap your health costs, health services costs at $6,000, $7,000. The drug cap is a separate cap. So that's very important to keep in mind. And then with the supplement plans, depending on your plan, you have the monthly premium. Maybe the only thing you have to pay is the Part B deductible, and everything else is covered that is covered by that Medigap plan. How do you choose? Well, there's lots of ways to choose, but some of it, I think really it's going to be based on what is your personal preference, what is your budget. Do you like the idea of being able to go to any provider that you want and not being restricted by a Medicare Advantage network? I have had clients who have had chronic conditions where their providers have said, if you can afford a supplement plan, that would be best for your situation. But everyone's situation is a little different. And so if you ever want to talk to me about which makes the most sense for you, I am happy to do that. So again, yeah, first things first, you got to enroll in Medicare when you turn 65. Okay. Then you can choose between a Medicare Part D plan, a supplement plan. You can go with the Medicare Advantage route. And here is just some information on the Medigap and the Medicare Advantage plans and how they differ. Medigap is going to be more expensive. I mean, there's just no way to get around that. So it's important to keep in mind that it is a little more expensive. Okay, so this is when we get into the specifics of when do you do what? So when you turn 65, your initial enrollment period is the 7 months around your birthday. And you can submit your application as early as 3 months prior to your birthday month. So if your birthday is in January, right? Anytime in January, you can submit your application starting October 1. I highly, highly recommend that you submit your application the full 3 months prior to your birthday month. We all know that Social Security is overworked, understaffed, and sometimes things take forever. If you get your application in early and they process it quickly, you'll get your Medicare ID card in, maybe a month, and you'll be good to go for your birthday month of January 1. But if there's a problem with your application or if they need more documentation, it just gives Social Security extra time to figure out what's going on, and you won't be as concerned about getting it all taken care of. So, whenever possible, submit it 3 months before your 65th birthday. Now, if you missed your enrollment, there are general enrollment periods every year, January through March, and you can enroll in Medicare Parts A and Part B. There may be late penalties at that point. Now, if you're enrolling in a Medicare supplement plan, you have the 6 months after you turn 65 to add that supplement plan. I generally recommend that if you know you're going to go with the supplement plan, let's just get all of it starting at the same time. So you'd enroll, you'd submit your application for Medicare at, the 3 months prior to your birthday. And then once you get your ID card, then we can handle enrolling you in the Medicare supplement plan, the Medicare Advantage plan. Now, maybe you've decided, hey, I enjoy working. My employer coverage is great. I'm going to work past 65. Absolutely can do that. Then what's happening is when you retire, there's going to be a 8 month open enrollment window for you to enroll in Medicare Parts A and Part B. But keep in mind, you'd have a gap in coverage then. So generally, I encourage people to figure out, hey, what's my target retirement date? And then you can sign up for Medicare in advance and just say, hey, Medicare, my last day of work is going to be December 31st, 2025. I'd like Medicare Part A and Part B to start on January 1. There's a form that you will have to fill out that will provide information about your employment and your coverage through your employer, just so that they will not charge you those late enrollment penalties. But generally, you can apply for Medicare 3 months prior to your intended start date. So I always encourage that. Here's some of the late enrollment penalties. Most people will not have a late enrollment penalty for Medicare Part A because it's free. Please note that if you enroll in Medicare Part A late, they will backdate it 6 months because it is at no cost to you. So that can be helpful, or it can create problems if you have health savings account plans. Medicare Part B, there's no late enrollment penalty if you have a special enrollment window due to having other coverage through a spouse or an employer. And then there is a 10% penalty for each 12 months that you went without Medicare Part B. Medicare Part D, the drug coverage, as long as you don't have a gap of more than 63 days, so basically 2 months, there's no penalty. Otherwise, it's 1% of the average premium for each month you delayed enrollment. So if you delayed enrollment for 3 years, it would be a 36% penalty based on the average premium. And changing your coverage. The nice thing about Medicare is you're not stuck with it. I always like to remind people that you're making a plan choice for now. You're making a plan choice for the next year. You're not committing to this till for the next 5 or 10 years. Every year during open enrollment, which is just around the corner from October 15th to December 7th, you can change your Medicare Advantage plan or your prescription drug plan, and the change would be effective on January 1, right? So you're requesting the change sometime between October and December. The change would be effective January 1. You can also switch from one Medicare Advantage plan to another one. You can move from Regence to Humana to Kaiser Permanente to United Healthcare. You can switch amongst them every year if you wanted to. And then specific to Medicare Advantage folks, and this is specifically if you already have a Medicare Advantage plan. There is a window from January 1st to March 31st where you can make one change to your plans, and you could switch to another Medicare Advantage plan, or you could switch back to original Medicare. And then just a reminder that the other time that you could make a change is when you have a qualifying life event. And for most people, that would be a move. So if you're on a Medicare Advantage plan based in Thurston County and you move to King County, you'll have a qualifying event because, again, Medicare Advantage plans are based on the county you live in. So then you would need to switch to a plan that is based in the new county that you live in or the new state that you live in as well. All right. Ways to save money. This is just a reminder to use your preventive services, stay in your plan's network if you have a Medicare Advantage plan, looking at the kinds of drugs that you're on and understanding what's going on with your services. There is extra help available if you have low income, and there are resources for that on the Medicare.gov and on the state websites. All right. And then finally, where can you go to help? Well, one thing is me. You're always welcome to come to me for help. You can go to Medicare.gov. All of the insurance carriers have websites that have information. And I'm sure if you haven't turned 65, you will discover this when your birthday is coming up. They're going to be flooding you with all sorts of information on their options and trying to get you to enroll in their Medicare plan. I encourage you to find an agent, whether it's me or if it's someone else, whether your spouse or your friend has an agent. Talk to someone who deals with Medicare every day, because I know when it's something that's new to you, it can be incredibly overwhelming, and it doesn't need to be. With that, that is everything I have prepared. What questions do folks have today? Anything else?
Yeah, Cindy, thank you so much for sharing some of the information that I think we all hear frequently and try and make sense of. So we are going to be able to provide a replay of this. So if you were listening in and there was anything you wanted to go back to and hear more about, you can do that. If there's someone that you know that it might be beneficial to pass on, we'd encourage you to do that as well. We will also go ahead and as follow-up to the meeting or replay, we'll send Cindy's contact information. So we'll have her website where you can go and schedule a call with her. There'll also be additional resources and information that you can find there. So for those of you that are thinking, I maybe do want to connect with Cindy and learn more, we're going to provide those details to you. We did have one person with a hand raised. I'm not sure if it was an accidental hand raised or if they had a question. So I will ask you if you do have a question to put it in the question and answer box, and we can answer that before the call wraps up. I think that, you know, Cindy and I were talking at the beginning of this call, and it's just every time this topic comes up, it's a bit of a making your head spin situation. And so, whether you're nearing the age where you're going to apply, or if you're receiving benefits and are no longer feel that it's meeting your needs, or as said, it changes. A lot of providers will change what they offer in a certain area. And so if there's a something that's causing you to have to make a change or revisit it, working with an agent is definitely a way to simplify the information and help to narrow down the options. I think that's probably the biggest thing that people are just there's so many options. Where do I even start? So if you can have a quick conversation with someone to talk about your own circumstances, the health side, the premiums, everything that you're kind of wanting to piece the puzzle together, then that person can say, okay, based off the things you shared with me, here's the two or three options that I think would make the most sense for you. Let's talk through them. So did you have anything to add as far as that, how do narrowing down or really kind of
Yeah, no,
focusing
I think
in?
that's great. I think thinking about how do you use your coverage, what doctors do you go to, where do you find you get your care for the most part, what kind of medications you use, thinking about tailoring your choices to the way that you use your coverage, and also thinking ahead as to what might you want to do in the future? Do you like the idea of a Medicare Advantage plan? Would you prefer a supplement plan based on the freedom of the network and all those kind of things? And I'm always happy to talk with people to kind of figure that out. 'Cause sometimes it just takes some time to kind of piece it all together and figure out what makes the most sense for you. And keep in mind, it's an individual choice. So, in a couple, one person could have a Medicare Advantage plan and the other could have a supplement plan based on their health needs. It's not something that you have to decide on to go with together if that doesn't make the most sense.
The other couple of things that I really took away is that it's ever evolving. So the good news is you can make changes as you need to, and also like the offerings, the program, all of it is ever changing. So just that comment that we made about like the donut hole is no more.
Yeah.
Very exciting. So there's things where it's continuing to adjust as the healthcare system changes, as our population ages, and all of those things. So we'll continue to try and keep you, informed of what the different options available to you look like. But again, since it is so personalized, working with an agent directly is going to be the best resource that we can connect you with. So you did such a good job of covering all those basics. There doesn't seem to be any more additional questions, but I'm sure once we put
Right.
up the replay and your contact information, you'll be getting some people reaching out to schedule some time to talk with you directly about their individual
Yep.
circumstances.
Sounds great. Happy to do that.
Yeah, well, Cindy, can't thank you enough. Really appreciate your time and thank everyone for joining this afternoon and more to come on other educational topics and events in the future.
All right. Sounds good. Thanks,
All right,
everyone.
have a great
Okay.
day.
Bye-bye.
Bye.